The Beatty Liver and Obesity Research Program is a part of the Center for Liver Diseases. It's the research arm of the Center for Liver Diseases at the Inova Fairfax Hospital. This program is housed within the Beatty Beatty Center for Integrated Research, the Inova Health System, which is located in Falls Church, Virginia. The Beatty program really focuses around liver and obesity and obesity-related liver disease.
We've developed a unique infrastructure for our team to conduct the extraordinary work here at the Beatty Liver and Obesity Research Program. We primarily have 4 areas of research that we focus on, such as clinical trials research, translational research, outcomes research, and liver pathology research. So our team is able to conduct between 12 to 15 clinical trials on average a year, and in the past year we've been able to assist over 70 patients, help treat their chronic hepatitis C as well as NASH diagnosis.
Specimen collection is the most important part of our clinical and translational research.
A lot of what I do is to classify the patients who are entered into the studies here. The specimens are collected from bariatric surgery and from patients who are seen with fatty liver disease. In the course of their evaluation or during their surgery, they have a liver biopsy performed, and as the pathologist, I evaluate the liver biopsy and classify it into whichever form of fatty liver disease is present, and then our scientists use those tissues then for the studies that they do on molecular aspects, genomics, and various other biochemical studies that we then correlate with the clinical features of the patient.
So in this facility, the translational research is focused on wide areas related to obesity and non-alcoholic fatty liver disease. And we are also focusing on chronic liver disease like hepatitis C infections. We are trying to understand the genetic and molecular basis of the whole body energy homeostasis and what's the crosstalk that's going on between these tissues in the process.
The nature of this research is getting to the heart of what patients value. We need to talk to them and really listen carefully. And what we're listening for are symptoms, perceptions, and so our instruments are able to capture those data in a very systematic and quantifiable way. That gives us intervention strategy.
We've done great work, especially in chronic hepatitis C. We've been able to show association between specific genotype of patients with the treatment outcome and the possibility of side effect. That's one very important thing that we've been doing here. In addition to that, we have also been able to develop a biomarker panel because our aim is to come up with a better, more accurate, less invasive method for detection of non-alcoholic fatty liver disease. And with that aim, we are trying to come up with a biomarker panel so we could help in the diagnosis or the screening of patients.
The medical outcomes program was started as a result of Dr. Younasi's very long-lived interest in quality of life measures. And what Dr. Younasi and I have worked very closely on over the last 5 years has been trying to get a continuum of measurement that goes from the blood-based measures, the proteomics, such as glucose, insulin resistance, inflammatory markers, linking that to good objective performance measures. By that we might mean the ability to walk, what the strength of the individual is, and then link that to the perceptions and the information that we have about the symptoms and how the individual is affected by their illness. That continuum gives us 2 really good opportunities. One, measurements that we can follow over time. And number 2, identify the risk factor.
What makes the center stand out in terms of non-alcoholic fatty liver disease research is the multidisciplinary approach that we have here, that we have collaborations between the clinicians, the surgeons, the hepatologists, pathologists, and the scientists who have different, who investigate different aspects of the biochemistry and then clinical features and outcomes of fatty liver disease.
The most rewarding aspect of our research is that we're able to offer patients newer and more effective treatment options to help patients with hepatitis C and other chronic liver diseases.
Our mission really is to deliver patient-oriented clinical services and patient-focused research in a comprehensive but also integrated way. And at the end of the day, our center is patients, both their quantity of life but also their quality of life. And what is important to them is important to us. So the research flow has been designed to address each aspect of what's going to benefit our patients at the end.